Hey everybody, for today's video we're going to do something a little bit different. We're going to do a medication review instead of a skill review. We're going to talk about TXA. We're going to talk about how it works within your body, when you can give it, and what routes it can be given. So let's start with some blood clotting basics. When you get a cut or injury, your body starts a process to stop the bleeding called clotting. Special cells in your blood called platelets gather at the injury site and stick together to form a clot. Your body's got a protein called fibrin that helps strengthen this clot. It acts like a net, holding the platelets together and making sure the clot's more stable. After a while, your body's going to start to break down the clot to allow for healing using a process called fibrinolysis. This is good, but sometimes the breakdown of the clot can happen too soon, and this can lead to excessive bleeding. So this is where TXA comes into play. TXA works by blocking certain substances in your body that break down fibrin quickly. By doing this, it helps keep the clot stable for a longer time, allowing your body to stop the bleeding more effectively. In the pre-hospital setting, there are several different types of patients which would benefit from the administration of TXA. This includes patients with traumatic injury and significant blood loss, hemorrhagic shock, patients with OB-related complaints and bleeding, such as heavy menstrual bleeding and delivery complications. As far as GI bleeds, there is no current data available that suggests any benefit for the administration of TXA. You're going to want to contact your medical authority or oversight on which patients are appropriate for you to give TXA to and what dosages to use. Now, there are some things we need to consider when administering TXA. First, we want to give the medication within the first 3 hours of the injury. For every 15-minute delay in the administration of the medication, there is shown a 10% decrease in the patient's survivability. Also, there are some side effects we can anticipate: anaphylaxis, thrombosis, nausea, vomiting, diarrhea, visual disturbances, and if you administer the medication too fast, you can cause hypotension. There are several different administration routes which have been shown to be therapeutic when giving TXA. It can be given through an IV drip, a slow IV push, or through an intraosseous needle. For patients that are coughing up blood, have a posterior pharynx bleed, or an esophageal bleed, it can be nebulized. For patients with uncontrolled nosebleeds or epistaxis, you can use a MAD device to spray it into the nasal passages. Another way is soaking gauze in TXA and applying it topically to wounds. As we wrap up our discussion on TXA, I want to highlight a few important points. First, TXA is most effective when it's given promptly, and its administration can drastically improve patient outcomes. Second, always adhere to your local protocols and guidelines regarding TXA administration. And last, make sure you're continuously monitoring your patient for any signs of adverse reactions and document everything accurately. Well, that's it for today's video. Thanks for stopping by and watching. Make sure you click like and subscribe.